Good afternoon. Thank you for joining us for today's webinar, Value Selling and the Healthcare Buying Process. I am Paul Carpinella from Leverage Point's Marketing Department, and I'd like to welcome you to another one of our monthly webinars on value-based strategy. Sponsored by Leverage Point. Leverage Point provides the only software platform for customer value collaboration. We offer a SaaS-based cloud platform that links all cross-functional team members involved in building and executing a value-based strategy. This changes the way that companies create, communicate, and capture value. You can find out more about us by visiting leveragepoint.com. A few housekeeping items before we begin. All participants are on mute for this call. If you have any questions, you can enter them in the questions panel located on the right-hand side of the screen. We'll answer as many questions as possible during the question and answer portion of the program. And also, you have an opportunity to win a copy of Chris's popular new book, Healthcare Value Selling: Winning Strategies to Sell and Defend Value in the New Market. You can enter for your chance to win one of 5 free e-copies by filling out the survey, which will appear as you leave the webinar. Now, my pleasure to introduce Leverage Point CEO and moderator, Peyton Marshall. Peyton?
Thank you, Paul. We're delighted to have with us again noted pricing practitioner, strategist, and award-winning author, Chris Provines. Chris is a healthcare and medical technology expert with over 20 years of industry experience. He's held executive roles at Johnson & Johnson and at Siemens Healthcare. Currently, Chris runs his own consultancy, Value Vantage Partners, where he shares his expertise and trains global clients in the areas of strategic pricing, value selling, and sales negotiation. Chris is an author of multiple books on strategic pricing in the healthcare industry, including his most recent one, Healthcare Value Selling, one of the best books I've read in a long time. We're privileged to have Chris as a member of the Leverage Point Advisory Board. He's also a popular adjunct professor at Rutgers University. A lot of us today are eager to hear what Chris has to say about value selling and the healthcare buying process. Welcome, Chris.
Thank you, Peyton. Thanks, Paul, as well, and the entire Leverage Points team. It's a pleasure to be with you all today, wherever you're calling from, and good morning, good afternoon, good evening. We are Veterans Day today, so for those of you who are veterans or veterans in your family, thank you very much for your service. Okay, so we're ready to get started? Okay, so we're going to talk about today a topic that's near and dear to me. It's really healthcare value selling. You know, the world has changed dramatically in healthcare, and regardless of you selling devices or diagnostics or pharmaceuticals or services, it's pretty clear that the old world of selling has changed dramatically. So what we're going to try to do today is really dive in a few areas that I think are pretty important for both sales and marketing teams as well as pricing teams to understand. That's first, understanding the customer's buying process. So how does your customer buy? That may sound pretty silly, but I'm always pleasantly and unpleasantly surprised at the level of understanding of this whole area across many industries, particularly in healthcare. We're going to talk about strategic sourcing strategies. So as the professional buyer plays a much more important role in the buying process in healthcare. How do you as a sales and marketing and pricing team think about that and deal with it? And then we'll jump into how do you use your value during that selling process. And lastly, we'll talk about, it's not good enough just to be able to sell your value. You have to, in this new market, be able to defend your value. So what are some tactics or techniques you can use to defend your value? Okay? So let's move on to the next slide. So we're in this shift that's happening, and I talked about we're moving from this old world of relationship and clinical feature buyers to this new world of a what I call a value and data-driven buyer, and importantly, a professional buyer. So more and more professional buyers are playing a much more bigger role in the buying process, and they're called all different things across the world, depending on what market you're operating in. They could be called purchasing, procurement, supply chain, strategic sourcing, materials management. They could be called pharmacists in part of Europe, for example. Whatever their name is, it's pretty clear that they're playing a much more important role. So part of what we'll talk about today is how do you deal with this new buyer, this professional, value-driven buying process? How do you make sure that you're able to actually leverage this and get past these buyers or get around or work with them, depending on the circumstance, to really grow your business? Before we jump into some of the tactics and some of the stuff happening, let's just step back and say, why is all this happening? I think there's a bunch of forces. I usually go through 10, but in the interest of time, I'm going to talk about just 6 of those 10. So these are 6 big forces driving change in how your customers are running their business. If you're selling to a hospital or a physician office or a surgery center or outpatient clinic of some kind, and these forces in turn are putting pressure on you as suppliers. So the first 2 are accountable care and value-based purchasing. Obviously, with the Affordable Care Act, ACA, there's been tremendous change in the United States. There's also change outside the United States, where more and more customers are really focused on getting value in their purchasing. Also, particularly in the United States, providers, physicians, and hospitals are becoming much more accountable for the care they provide. And we all know there's lots of penalties and other mechanisms in there that payers are now tying to cost, quality, and outcomes performance. Transparency is a big trend that's driving a change, whether that's price transparency, whether it's value transparency, or whether it's outcomes transparency. It's going to have a big impact on the buying process. Next, of course, the maturing hospital supply chain or healthcare supply chain. If you look at academic surveys of industries where they rank various industries and their purchasing or supply chain capabilities, often the industry that falls towards the bottom or often is at the bottom is healthcare. And within their hospitals have been not the best in terms of their capabilities in supply chain and purchasing. And that is rapidly changing, and they're getting much better. That, in turn, is putting pressure on suppliers and their sales teams. Importantly, sorry about that, we went the wrong direction. Let's move that up. Next, importantly, is reimbursement cuts. Of course, this is having a big impact on your customers and the financial pressures they feel. And as someone who's worked in purchasing, whenever you face financial pressures, the first place you look is your supply base to see if you can get more value. And then lastly, hospital consolidation. So depending on who you talk to, I've talked to hospital CEOs, CFOs, and COOs. Some are prognosticators and will say that if you look at the hospital industry, maybe 50 or 100 very large systems that run most of healthcare in the United States. So we're seeing tremendous change. Whether you agree with that statistic or not, it'd be hard to argue that we're not seeing lots of consolidation. And for selling your value and for pricing, that's becoming a big driver and lever of how you should be thinking about the market. Okay, so there's lots of pieces to the puzzle of going through value selling and making sure that the customer really understands your value and that you're in at the right part of the buying process. There's also a lot of pieces of the puzzle in terms of making sure that you're defending your value appropriately. But we're going to talk about just a few today. And the first one is really doing a deep dive on the buying process. So how does an organization buy? How do professional buyers buy? How do they think about you as a supplier? We're going to talk about understanding the professional buyers. So what are their goals, interests, fears, and desires? How do you understand what they're looking for so you can best leverage your value? Next, we're going to talk about leveraging hospital buying behavior. And this is just the basic premise that every hospital buys a little differently, but you can usually categorize them into different segments. If you are clever about thinking about how they're buying, then that gives you some opportunities to use your value as well. And then lastly, really use your value to educate the customer. And I always tell people this is really about helping your customer make an informed buying decision. There are statistics out there that even the best run purchasing or procurement organizations only do value analysis 1/3 of the time for important purchasing. So if you're waiting for your customer to do the value analysis and do it correctly for your products or solutions, you're going to be in a lot of trouble. So you have to determine what is your value and use that to educate the customer. So overall, I think it's really a new level of sophistication in selling and defending value is required in this new market. Okay, so I'm paging through some of these upfront slides a little quickly. That's in the hopes that at the end we'll have a rich discussion around some of the questions. Often the real value comes out of the questions you all ask, so please think about questions. But this is a slide 10, is that I like to use to really get people grounded in how does the hospital buy. And again, this isn't Chris making this up. I'm actually teaching global procurement and strategic sourcing this semester at the university. If you pull out the university textbooks, there's laid out something very much like this of how professional buying organizations buy. In fact, you could go out to a number of your large IDN customers in the United States, and on their website, they'll have a process just like this. So I'm going to walk through this, and I'm going to touch on some really important points about this buying process, particularly as it relates to your selling, to your pricing, to your negotiating your value. Okay? So it's a really simple process here. It starts with step one, which is recognition by the customer that a supplier can help with a problem or opportunity. That's step one. Step two is they'll analyze the opportunity in the supply market. Step three is they'll determine the strategic sourcing strategy. So that just means how they're going to buy whatever the good or service is, and we'll go through that in much more detail. Step four is invite suppliers and evaluate the solution. Step five is select the supplier and negotiate terms. And then step six is basically implement the agreement or the contracts and manage supplier relationships. Okay, so very simple 6-stage process. Again, I could give you links to a couple of very large IDNs in the US, and I may have a 5-step process, some might have a 7-step process, but essentially they're doing this. And from this process, there's some important insights. So what is the customer trying to get done? In the beginning of this process, they're really looking for qualified opportunities. So what's a real opportunity for them to do? Usually one of three things: reduce costs, improve quality, or improve outcomes. And during those steps, they're looking to develop a qualified opportunity. They're developing clear requirements, and they're putting together what they'll call the decision criteria. So at the end of the day, how are they going to make a buying decision? Second output of this process is usually a sourcing strategy and a negotiation strategy, right? So they do all of this in advance. And then as you get towards the end of the process, they are implementing the relationship, putting together supplier scorecards, and implementing the contract. So there's an important insight from this, and this comes from the Challenger Sale book. If anyone's read that book, I'm sure many of you have. And the insight is that 60% of the customer's buying decision is shaped by the time they formally reach out and engage suppliers. So for those of us that have worked in procurement or teach in the area, this is not a big insight. It's not a big aha, because if you look through steps 1 through 4, this is exactly what purchasing people are taught to do, right? Do all of their homework up front, make sure that they have very clear criteria for how they're going to buy things. But there's important insights from here from a selling perspective. So let's say an RFP shows up in your mailbox tomorrow morning at 8. You've not heard at all from the customer about whatever they're buying. You have to ask yourself, is it real? If they've gone through this entire effort and they're now reaching out to you, is that really a real opportunity? Likewise, if you're the incumbent vendor in the situation and it shows up, you have to ask from an incumbent vendor's perspective, are they really going to switch from me, or is this just a game they're playing with me? But there's also other insights by thinking about this process. So if you go back to step 1, recognize problem or opportunity, that can come from a variety of sources. That can come from you, obviously helping uncover insights for your customer, helping them understand and recognize an opportunity that you can help them with. It could also come from your competitors, right? Your competitors could be in there selling, so they could be creating the opportunity for the customer. Oftentimes, opportunity recognition will come from benchmarking. So the customers may be at a conference with other purchasing people, and they hear about great pricing other hospitals are getting for the same things they're buying. It could come from their GPO. It could come from consultants, purchasing consultants. So it could come from a lot of places. The point is, if you're not in there early enough in the buying process, that opportunity is going to be shaped by someone else. And sometimes, and oftentimes, that will be really hard to go up against that. So you have to be really engaged early on in the buying process. There's a couple of other important points with this chart. It's step 3, and we'll go through this in a little more detail. The customer is really developing a strategic sourcing strategy. So that just means, how are they going to actually buy that good or service? So smart buyers don't just willy-nilly do this. They have a strategy. And they'll develop a strategy based on what you're selling and the supply market characteristics. And so part of what you have to look for in selling your value and marketing your value is there a mismatch between their sourcing strategy and what they're buying. And we'll talk a little bit more about that. I think another insight from this chart is if you go all the way to step number 6, the buyers are supposed to be doing something called SRM, or Supplier Relationship Management. So just like sales organizations have CRM, or Customer Relationship Management, buying organizations have SRM. So they're supposed to be working with a supplier, really partnering, developing a relationship with those suppliers that they deem to be strategic. So this is a perfect opportunity for you. If you're the incumbent vendor, you should be having that conversation. You should be bringing that up in business reviews. You should be talking about that. You know, a simple question to ask more sophisticated buyers is, what type of supplier scorecards do you use? And if you're working with them, do you actually have a scorecard you actually review with them during business reviews? So in step number 6, if you're not communicating your value, not reminding them of the value you're bringing, then you're missing a big, big opportunity, because they will conveniently forget during the next RFP round or next bidding process. Okay? So some important insights on this process. You should be selling value early on in the process. So as they're shaping their buying criteria, you should be helping influence that and shape that. If you're outside the United States in a tender market, obviously you have to do that in a legal way. But there are certainly ways to shape that buying criteria so that when the bid comes out, the evaluation criteria comes out, it's actually very much in your favor. So you kind of tilt the playing field to favor yourself, if you will. Okay. So one of the things you also have to do in this new world is professional buyers play a more influential role, is really understand what they're all about. So they have many goals. I've listed a few of the top ones here. First goal primarily is to reduce costs. So if you have a chance and you have a good relationship with the director of supply chain or materials management at the account you call on, one of the things you might want to do is just ask them what their goals are for the year, for this upcoming year. What are the goals? What are they trying to get done? Usually it's reduce costs. Most organizations will have at least a 5% savings target. More and more in hospitals are getting savvier about connecting suppliers and the supply chain to patient outcomes. So patient outcomes related goals might be in there. Managing risk is often a big goal or objective for supply chain and purchasing folks. So if your products or solutions have a better risk profile than your competition, it's certainly something that you want to be able to sell early on and help shape the buying process. Managing internal stakeholders, and then obviously their personal worth and credibility. So if you're a high-performing supply chain or procurement person, many of them have aspirations to do something else eventually, so they're really trying to build their own credibility and worth. And so as a supplier, you have to think about, is this an opportunity to collaborate with them or not? But usually in any selling situation, when you're dealing with professional buyers, there's always a group of them. And there's even for the best professional buyers, they will at times want to play games because they've recognized that playing games works. So here's a quote from a head of purchasing. I usually pick out which supplier wanted advance. It's usually the high value, high price supplier. I then add many bids into the bid process. Inevitably, one of the suppliers bids low, and I use this as leverage with my preferred supplier. So this is a standard negotiation sourcing tactic. In fact, I did a presentation to a group of professional buyers. There's about 120 or 150 of them. And I asked by raise of hand, how many of you actually issue an RFP when you have zero intention of ever switching from your incumbent supplier? And you can probably guess how many hands were up, but everyone in the audience had their hands up. I went up to a young lady in front and said, "Why do you guys do this?" She's making all the suppliers jump through hoops. And she said, "It's a real simple answer. It works." So it's a very simple tactic that works for them. So as a sales organization and a seller, you not only have to be able to sell your value, but you importantly have to be able to defend your value and defend it against games that come at you. So in that context, I wanted to just show you some research that I think is pretty interesting. So this is a standard negotiation model. It's been around for almost 40 years. So on the vertical axis is cooperativeness, so it's your concern for the others. And on the horizontal is your assertiveness or concern for self. So how much are you concerned about yourself? And then the vertical is how much are you concerned about others? And this has been used by researchers over time to study negotiations and selling situations. So real quickly, if you're down low on both, you'd be avoidant. If you didn't have high concern for yourself, but had very high concern for others, you'd be accommodative. In the middle, you'd be sharing. If you have high concern for self, but not high concern for others, you'd be competitive. It would be more win-lose. And then the ideal world is up to the upper right-hand corner where you're both concerned for self and concerned for others. Okay, so this is a standard 5 negotiation styles that have been studied over time. There was a study done not too long ago, where they asked professional buyers, what's your preferred negotiation style using this model? And 70% claim that this is their preferred model. What's interesting is they will move down to the lower right-hand quadrant to competitive win-lose if a couple of things transpire. If they think they're being treated unfairly by the supplier, if they're distrustful of the supplier, if they view the supply item as not being terribly important to the business. Those are the general things that will push them down there. Also, what the research showed, and I can validate from my own personal experiences, if they see weakness in the supplier and the supplier really doesn't understand their value, it's much easier to go be competitive than it is to be collaborative. Collaborative usually takes a little more effort to come to agreement on things. So the point is, from selling your value, if you're not really clear on your value and you don't have real backbone in your selling process, you could end up in a situation where the buyer wants to be collaborative with their preferred style, but they push you down into a competitive position and make it win-lose. Okay, so part of understanding buyers and how to sell and how to negotiate with them is really put yourself in their shoes and understand from their perspective how they view what you sell. So I like to use this model. Again, this isn't Chris making this up. This is called a supplier segmentation, or some people call it a portfolio model. It's just a way of taking all of the things that a hospital buys and putting it into a quadrant so you can have a strategy for how you source these things, okay? So real quickly, on the vertical axis is the customer characteristics. So this is basically how much money they spend. It's not the price of the item, but if you go to their budget, it's how much budget money exists, so either low to high. And on the horizontal is the supply market characteristics. So this comes down to how influential and how much of a preference item is it? Does it have very high physician preference? As an example, you'd be over to the right. How many sources of supply exist? What's the switching cost? Is it high or low? And then how critical is the item to care? So if you take any hospital and you look at what it is they have to buy to keep their operations running, I mean, it's tens and tens of thousands of supply items, right? And so they couldn't possibly develop a strategy for all of those. So one of the things they've historically done is outsource purchasing or parts of purchasing to their GPOs. The other thing is they'll take and bucket their supplies into categories, and they'll call this category management, and they'll put it on a map like this. And this helps them really think about strategy. So if I'm a buyer and I'm buying something where I spend a lot of money, but I think there's a lot of suppliers, really low preference from a clinician standpoint, low switching costs, that would be something they would call a commodity. If you're in the upper right-hand quadrant, this is where they spend lots of money, but there's lots of stickiness in the marketplace. There's a lot of physician or clinician preference. There's fewer sources of supply. There's high switching costs, and it's relatively critical to care. That's something they would say is strategic. They, ideally, if they're well run, would want to have a strategic relationship with their vendor. Next, down low is where they don't spend a lot of money, but it's real sticky. That's what they would call key. And then down in the lower left-hand quadrant, these are things that they don't spend a lot of money on, but they're easy to switch, right? So I do know some very large hospital systems, and they take all of these tens of thousands of items that they purchase, and they put them into categories. And one in particular has 300 categories. And they would put categories on a map like this. And from that, they would develop their sourcing strategy. So how are they going to attack that supply item? So they will obviously attack things differently if they think it's a commodity as opposed to strategic. You can also think about your product life cycle through the lens of this chart. So as an example, when a product becomes new to market, if it's highly innovative, it usually starts out in key. You have few competitors. There's high preference. Key, by the way, is an area where traditionally supply chain is not paid a lot of attention to because it's not a lot of money there from savings perspective, but it's really hard to switch. As you grow your business and follow the product life cycle, you get strategic. As you eventually grow and grow and grow, and the market matures and competition enters, you get to commodity and then hopefully not to decline. But this is a way to think about your solutions through the lens of the buyer. Okay, so the other thing that's important to do also is think about how your customers buy. Everybody buys differently. It's driven by the maturity of the purchasing organization, by their buying rules, by the financial pressure. I like to think about it in these four buyer types. So I like to keep things relatively simple. So you have a value seeker. This is usually a sophisticated buyer who's interested in value and is willing to make trade-offs. You have a traditional buyer. This is an account where physician preference still drives, where the physicians primarily are calling the shot. You have the innovator, and they're just that. They're an account where they're actually competing based on innovation. So they're looking for innovation from suppliers. Innovation is really important to them. It could be a center of excellence as an example. And then lastly, you have the price buyer. And price buyer is just that by definition. They're a buyer who only, for whatever reason, only cares about price. Okay. So ideally, you want to approach these accounts differently, right? If you have some kind of segmentation, you want to be thinking about, I'm not going to offer the price buyer the exact same offering as my traditional physician buyer or my innovator. Price buyer only cares about price. I need to somehow unbundle my offering, my products and services, and get in there with as low price as possible, if that makes sense. Okay, so we've talked a lot about professional buyers, how they buy, how they think, how an organization buys once they become much more mature. And we're going to talk a bit about value and using your value and close this out. So you first need to understand your value. What is your value? And I like these two quotes, one from Albert Einstein. So everything that can be counted does not necessarily count. Everything that counts cannot be counted. And then Lord Kelvin, when you cannot express what you're thinking about in numbers, your knowledge is of a meager and unsatisfactory kind. So two interesting perspectives of value. Question you have to ask yourself is, who do you agree with? Obviously, both of them geniuses. Personally, I agree with both. So I think you first have to take a holistic view of your value. And that really comes in three parts. It's looking at your clinical value, where we really do have differences, your economic value. So trying to put that in monetary terms for the customer. And then never forget emotional value. So risk, trust, relationship, brand, service, all of that stuff obviously counts. And you need to focus on where you have differential value. Even if you can't quantify this stuff initially, you should be thinking about where am I different, how am I different, even if I don't have studies yet to prove it, or even if I can't quantify what it's worth. It's always something you want to use to remind the buyers. But ideally, you do need to quantify where you can. So you have to go through the economic value and think about how am I taking costs out, how am I improving the revenue profile, reducing reimbursement penalties, et cetera, for the customer. How am I improving risk? What does that risk translate into financial terms? And then am I helping them reduce their working capital? So ideally, it's really going through and capturing what are you doing for their business? Because as I mentioned at the beginning of this talk, if you look at some of the studies, even the best, most well-run organizations only do total cost of ownership 1/3 of the time for important purchases. So if you're relying on your customer to quantify the value for you, either you're not going to do it, they're going to do it and possibly get it wrong, and then it's hard to convince them otherwise. Or they may do it and not actually tell you and use it against you in the negotiation process. Okay, so we've gone through this fairly quickly, some of these slides. I just wanted to wrap up with really 3 points. It should be clear as your customers become smarter buyers, they become much more formal in how they buy goods and services, and as the buying decision migrates from purely clinician-only to committee-based and much more value-based buying, that you really need to proactively engage in the buying process much, much earlier than you have. That's really teaching the customer about your value, understanding RFP processes and bid processes and when they're surprises and not. Next, you really have to shape customer value perceptions. If you leave it up to the customer to quantify the value for you, you could be in a lot of trouble. And I know, obviously, in the device and healthcare, with your legal and regulatory departments, it's not always easy. A lot of products you probably haven't invested in the evidence in the past, so it becomes difficult. But if you don't start now, you'll never be able to do it. So you need to be able to really clearly communicate your value. And I think there's 2 important points here, too, is really understand switching costs and understand it from your position. So if you're the incumbent supplier, how do you raise switching costs? If you're on the outside and you're trying to get inside of the account, how do you lower switching costs? And switching costs are just the cost the customer incurs to move from one vendor to another. And then lastly, obviously, it's not enough to just be able to just sell your value. In the world of professional buying, and it's going to increase more and more in healthcare as they become more sophisticated buyers as an industry, you're going to have to be able to understand and work with these folks and really recognize their gains, but also recognize at the end of the day, they've got a job to do. They're good people by and large. They're not out there to make your suppliers go bankrupt, but they are looking for good value. So you've got to figure out ways to work with them, but also for those that bluff, be able to understand how to recognize those bluffs and deal with those. Okay? So with that, we're going to move back to Peyton and move on to some questions.
That's great, Chris. Thank you very much. Some terrific insights there. We have a few questions that came in during the webinar, and by the way, there's still time to enter your question on the panel on your screen. While you're entering, just a few words about Leverage Point, a single platform for customer value collaboration through the product lifecycle. Many Leverage Point customers start with our value-based platform on the product development side, beginning with product design and moving through their stage gate process to product launch. Going to market, our customers develop customized marketing and sales content that enables sales to communicate value at critical points in the sales process. A platform facilitates collaboration among cross-functional teams as they plan product launches and as they execute. Using technology and a common framework to embed best practices and the best information leads to better outcomes in multiple dimensions, from better product decisions to better sales execution, which leads to the whole point of a value-based strategy, higher margins and better performance. Executing on value selling is all about teamwork. Good value propositions aim for the right people, to deliver the right messages, to the right audience, at the right time. Our cloud platform is readily usable by sales. A dynamic value proposition is both more flexible and more effective than a static PowerPoint deck. Sales teams deploy simple, tailored value propositions with strong value headlines, easily changed by sales for customer specifics, with consistent graphics and messages, and with ready access to information and the ability to drill down into quantified value as appropriate. Sales teams build customer trust as they validate an offering's value through consistent sales conversations with accessible collateral supported by leverage point. Thanks. So I see we have some great questions. So Chris, what advice do you give to companies just getting started in value selling on where to start? What products, types of customers, sales, generalist sales versus subject matter experts, medical science liaisons?
Yeah, that's a big question with lots of parts, I think. But, obviously for most of the companies on the phone here today, you probably have a legal and a regulatory department, and they control a lot of what you say, and a lot of that is based on what evidence exists for whatever point you're trying to make, right? So oftentimes this works best if you're just starting with the newest, best thing that you're launching. So usually a new product launch where you've had the chance to invest in at least some evidence and some proof points to explain why you're different is usually the easiest place to start, particularly if it's an important product. Obviously, if it's an important product and it's going through your pipeline and you've at least been able to invest in some evidence along the way, this is really, I think, the easier place to start. To go back and take products that have been on the market for a while and try to generate evidence or find differences is hard. With that said, sometimes the value, you have to look at value holistically. Sometimes the value is not always in the product itself, but it's in all of the wraparound services and programs that a company provides. And oftentimes those are easier to quantify from an evidence standpoint. So often look at, particularly if the product's been on the market for a long, long time, is more at the mature stage of the product lifecycle, look at what are the wraparound program services, things like delivery, all of that stuff does have value and you can quantify it.
Thanks. So next question, what about times when the customer pushes you from strategic to commodity? For example, they communicate that there's no real difference, at least in their opinion, between vendor A and vendor B.
Yeah, no, that's a great question. And if you go to Purchasing School 101, one of the first things, particularly if you're dealing with a purchasing person, they're going to tell you, and everyone on the phone who's sold will have heard this in their lifetime, is that's a commodity, they're all the same. So oftentimes they will say that even if they don't believe it. It's basically to devalue your offering and put you on the defensive. So you really have to look at it holistically from the perspective of how does the account think about it overall, not just how does the purchasing or supply chain think about what you're selling. And I will tell you, even if your product has reached the mature stage of the product life cycle, and let's say there's little difference between the physical product itself, and maybe it does sit in the commodity bucket, oftentimes the real value then becomes the services you're providing. So inventory management, your delivery, the education, training, all of those things, the value often switch from the product to all the wraparound services. And oftentimes that's where you do have differences.
Great. So if the professional buyer is not the decider, who is?
Yeah, it depends on what you're selling, but the research I've done shows about 90% of hospitals have at least one value analysis committee. We know that P&T committees have existed since the 1900s in hospitals. So oftentimes these days, it's the value analysis committee, which is either chaired by a physician or some other clinician, or oftentimes the director of materials. So it's often more of a committee is the decider. But obviously, a committee is made up of individuals, so you have to figure out who has the most influence as individuals. And again, part of this the level of influence will depend on what you're selling. And if you go back to the 4x4 with the quadrants, where does it fall in there? So if it truly is something that's more commodity in nature that they spend lots of money on and there's really easy to switch, lots of competitors, then the economic buyers probably do have more say-so in that. But I'll tell you a funny story. I was talking to a director of materials, and he was telling me about they had a value analysis committee meeting on surgical tape. And someone said, why are we even wasting our time talking about this? Let's just switch and get the lowest one. And that's what they did. And he said, you wouldn't believe the headaches that caused. The tape, whatever the alternative tape was, it was sticking when it wasn't supposed to be sticking and not sticking when it was supposed to. So it was creating all kinds of infection barrier issues and patient discomfort. So you think of something as simple as surgical tape, which at least, I haven't worked in the tape area, but at least in my mind, I'm thinking maybe that's a commodity. But even he was saying, you wouldn't believe the headache that put us through. So understanding what are the real differences, where are your performance differences are really important.
Great, thanks. So there's a question that even I can answer, which is, will these slides be shared? Yes. Everyone will get a copy of the presentation slides as well as a link to the recording. So, Chris, you've said a lot about hospitals and the provider community. What role do you see for value in the payer community?
Yeah, obviously the payers are more and more looking for value. If you go to Medicare as an example, as our biggest payer in the United States, all of the programs they're implementing are all about value. It's about cost, quality, outcomes, right? Also with the voluntary ACO programs and bundle payments, it's really about coordinating care and trying to take costs out. Some of these things have existed on the private payer side before even Medicare jumped on the bandwagon. They've been around for a while, but private payers are getting into this. So I think generally, if you are prepared, if you have good solutions, I think the movement of both providers and payers much further down the path of thinking about value and purchasing decisions, personally, I think is a really good thing.
Here's another question related to segments. Are there different approaches to smaller size providers compared to the larger provider systems?
That's kind of a broad question. When I think about segmentation, it's less about size, but more about behavior. And I think I didn't want to overcomplicate the slides, but I think there's really two dimensions to it. One is behavior. So how do they buy as an organization? What's important to them? Are they interested in value and partnerships for the suppliers? Do they look at suppliers as the enemy or actually as a capability? That's an important point. So look at how they buy as an organization. The other thing to look at is how do they make money? And we all know in healthcare, no margin, no mission. Even if you're not for profit, you need to have a margin to stay in business. And you have to think about how they make money. And if I'm a hospital that I'm a rural standalone, I'm not part of an ACO, I may make money very differently than if I'm part of an accountable care organization or I have my own insurance products as a hospital. So part of this is thinking about how do they buy, but also how they make money. I can tell you that broadly speaking, at least the research I've seen and a lot of feedback out there is there's a lot of people that believe little hospitals are not going to survive by and large, that they're going to be either gobbled up or closed or in very rare instances, will they be out there on their own surviving?
Good point. Good point. Some salespeople are reluctant to sell based on value because of their concern that customers have better data than they do. Any thoughts on how to give them courage and get them started?
Yeah, at the end of the day, I think you have to be seen as, particularly if you're dealing with more professional buyers, you have to be seen as someone who's part of the solution. And I've talked to lots of hospital C-suite people. This is what they're looking for. This is what professional buyers generally are looking for, is how are you part of the solution? So if you're just talking to me about features and benefits, you are not part of the solution. You know, as a professional buyers, you know, if you're blah, blah, blahing on features, that goes right over their head. You're seen as someone who's pushing a product. Whereas if you can actually translate in economic terms what you think your solution is worth, at least now you're having a discussion about their business and financially what you think you can do to help them in their business. Now, they may not agree with your numbers, but just getting them to talk about them is actually a big win, because you're debating a number as opposed to whether there's any value whatsoever.
Interesting. Here's a related question. How do you suggest handling buyers who don't communicate much and don't want to be educated?
Yeah, so we didn't have time in this session. Maybe there'll be a follow-up session, is really talk about the maturity of buying organizations and how that plays into their behavior. But you do have some who are view suppliers as the devil, as just a cost, and they'll play all kinds of games, and including either shutting you off or not wanting to hear from you. And, you know, that's really, those are the old buyers. Those buyers, by and large, will disappear over time as either they're gobbled up or fired or laid off, honestly. I think that's what's going to happen. I had a guy at a conference I presented at, the professional buyers, and he came up to me and he said he introduces himself as the sales prevention department to every salesperson. And I just thought, you know, what a dumb perspective, right? You should be looking at your suppliers as capabilities, not as costs, and thinking about how can you use them to grow your business and improve your business. So part of this is you have to figure out, is that person going to be around? And part of it is, are you selling to the right person? And can you go find someone else in that organization that gets it?
Absolutely. So I think we have time maybe for one more question. There's still some stacked up here. But you've talked about offering value-added services to take some of the heat off your product's price. Can you elaborate on some of the services that are highly valued in the clinical space?
Yes, when I was talking about value-added services, I was more talking about what's traditionally happened for many device companies is, over time, to compete, companies have not only innovated on the product front, but also added and bundled in free services, whether that be training, which you have to train your clinicians on your products, obviously, but training, delivery, special support, overnight shipping. You can go on and on about the various things that companies have done. As companies are facing cost pressures, what they have to do is now start to think about unbundling, much like they've done in the airline industry. You don't want to be hated like airlines, but part of this is understanding all of those services. Do they or do they not create value for a customer? What do they cost you to provide? And if they do create value for your customer, do you have to give them to everyone, or should you be using them more as a negotiation trade? So part of becoming more sophisticated over time, I think, is unbundling, really understanding which services create value, who to offer those to, and if you're going to use those, how to use those in a negotiation more effectively.
Great point. So speaking of airlines, I think we're coming in for a landing. So I'm afraid that's all the time we have for questions today. I see there are a few left, and really, please feel free to reach out to Chris or us directly with additional questions. So thank you so much for that, Chris. Paul?
Great. Thank you, Peyton, and thank you, Chris. Those are some wonderful insights and some really good questions by the audience, so thank you as well. And thank you, Peyton, for moderating. A few programming notes before we move on. Our next webinar is coming up a week from tomorrow, Wednesday, November 19th at 1 p.m. Eastern. Join us for Dr. George Cressman's insights into transforming commodity products into value offerings. Then December, we'll be presenting our product roadmap. There have been a lot of exciting enhancements to the tool this year and a lot more exciting enhancements to come. So join us on December 16th to learn about these enhancements and how LeveragePoint is enabling B2B enterprises to better execute a collaborative value-based strategy. Details and registration emails for both webinars will be coming out shortly. Again, thank you once again, everyone, for attending, and Chris, for your wonderful insights. As Peyton did mention, all attendees will receive a copy of the slides and recording within the next 1 to 2 days. And don't forget about your opportunity to win a copy of Chris's popular new book. You can do that by completing the survey, which will appear as soon as you leave the webinar. Thank you again, and have a wonderful rest of the afternoon. Bye.